Saffron is used for depression, for PMS symptoms, postpartum depression, memory, appetite suppression, energy and stamina in athletes, and for preventing neurodegenerative diseases like Parkinson's and Alzheimer's. It's the dried stigma of the Crocus sativus plant, which is native to the Middle East, and it's the world's most expensive culinary spice, largely due to the way that it has to be grown and harvested. Saffron has been used for thousands of years as an anxiolytic, a sedative, and an antidepressant. Today, it's used to help to manage appetite, for energy and stamina, anxiety, and it's a very popular, effective antidepressant. Recent studies have shown that saffron is as effective as some of the popular prescription antidepressant drugs, and it can also help to alleviate the sexual dysfunction that's caused by these drugs. The saffron extracts, crocin and saffronol, inhibit the uptake of dopamine and norepinephrine in the brain, and this helps to improve the mood. Saffron inhibits the deposits of beta-amyloid plaque, which is associated with the progression of Alzheimer's disease. It also inhibits the breakdown of acetylcholine, just like the current medication that's approved to treat Alzheimer's. Crocin and saffronol are unique carotenoids in saffron, and they make it a potent antioxidant, scavenging the free radicals, which reduces inflammation, preventing apoptosis or cell death, and protecting brain cells and the mitochondria. Documentation of saffron use over the last 4,000 years for at least 90 illnesses has been uncovered. Saffron takes a long time to germinate from seed, and 3 years for the plant to flower. Once it flowers in mid-autumn, the flowers must be picked carefully by hand within 1 to 2 weeks. Each Crocus sativus plant produces 3 to 4 flowers per season, and each flower produces a 3-pronged style, each prong terminating in a vivid crimson stigma. Saffron is the dried stigma of the Crocus sativus. This labour-intensive production method makes saffron the most expensive culinary spice in the world. Saffron contains the metabolites crocin, picrocin, saffronol, and the antioxidant lycopene and zeaxanthin, as well as vitamin B12. For the brain, saffron can be used for depression, PMS symptoms, postpartum depression, memory, appetite suppression, and preventing neurodegenerative diseases like Parkinson's and Alzheimer's. Recent studies suggest that brain-derived nootropic factor, nerve growth factor, and CAMP response binding protein, or CREB, all play a role in anxiety and depression. Further research shows that saffron has a significant effect on brain-derived nootropic factor, nerve growth factor, and CAMP levels in the brain. This likely explains why saffron is so effective in treating teenage anxiety and depression. One study in 2018 had 80 participants aged 12 to 16 with anxiety and depression try a saffron extract of 14 milligrams or placebo for 8 weeks. The study concluded that the saffron was effective in relieving the symptoms of separation anxiety, social phobia, and depression compared to a placebo. Researchers in the psychology department at Murdoch University in Perth conducted a systematic analysis of every clinical trial that they could find for high-quality, randomized, double-blind studies using saffron, a placebo, and antidepressant medication as controls in humans. The team concluded the clinical trials support the use of saffron for the treatment of mild to moderate depression. One of the most common symptoms in Alzheimer's patients is depression, and doctors commonly prescribe antidepressants for treatment, including drugs like sertraline, despite the fact that these medicines don't work for Alzheimer's disease and they come with a host of side effects. An alternative treatment is obviously needed, so researchers set up a double-blind, placebo-controlled trial with 46 Alzheimer's patients. The patients were given 15 milligrams of saffron twice a day or placebo for 16 weeks. The results of the trial showed that the saffron produced a significantly better reduction in behavior and psychological symptoms than the placebo, and they concluded saffron is both safe and effective in mild to moderate Alzheimer's. The acetylcholinesterase inhibitor Doprozil or Aricept is prescribed to Alzheimer's patients. It's for increasing acetylcholine, which has been found to be low in these people. A 22-week randomized double-blind trial with 54 Alzheimer's patients was conducted to compare Doprozil and Saffron. Patients received either 15 milligrams of Saffron twice a day or 5 milligrams of Doprozil twice a day for the extent of the trial. This phase 2 study found the saffron extract was as effective as the Doprozil in the treatment of mild to moderate Alzheimer's, but saffron did not produce the side effect of vomiting. Depression is a growing health problem, with over 10% of Americans taking prescription antidepressants, of whom 90% experience at least one adverse side effect, ranging from sexual dysfunction to convulsions to bleeding disorders. Antidepressant use can result in abnormal bleeding, agitation, aggression, anxiety and delirium, confusion, convulsions and even death. It can decrease memory and bring on delusional thinking, hallucinations, headaches and heart attacks, insomnia, lethargy, nightmares and panic attacks, sedation, impaired driving and slow speech, sexual dysfunction, paranoia, suicidal thoughts and violent behavior, serotonin syndrome and withdrawal symptoms. A growing database of studies and user reviews shows that saffron helps to treat depression without the risky side effects of prescription antidepressants. Saffron has also been shown to be effective with other conditions for which antidepressants are prescribed, including anxiety, Alzheimer's and obsessive-compulsive disorder. There's even a host of reports of saffron reversing the sexual dysfunction that's caused by using prescription antidepressants. Studies show saffron can be an alternative to some of the popular antidepressant medications and for anxiety. Another study with 18 to 45-year-old women who were suffering from postpartum depression showed the saffron was effective in reducing this depression. And a group of women aged 18 to 45 dealing with premenstrual syndrome found that saffron was effective in relieving depression during 2 menstrual cycles. Saffron is a smooth muscle relaxant and it helps to lower blood pressure, likely because of its inhibitory effect on histamine receptor, stimulatory effect on the beta-2 adrenoreceptor, and an antagonistic effect on the muscarinic receptor. Saffron inhibits acetylcholinesterase, and this increases acetylcholine in the brain, improving signaling and helping with learning and memory. Saffron inhibits the deposition of amyloid beta peptide fibrils, and these have been implicated in Alzheimer's disease. Several human studies show saffron is as effective as some popular antidepressants in treating mild to moderate anxiety and depression. Some of the symptoms of Parkinson's disease originate from the underutilization of dopamine in the substantia nigra area of the brain. Studies show that saffron helps to protect the substantia nigra dopamine neurons that are associated with Parkinson's. Newly published studies show saffron helps to protect your eyes from ultraviolet blue light radiation and flicker sensitivity from glaring monitors and headlights. Saffron improves the oxygen and the nutrient supply that's required for healthy eyes by boosting blood flow in the retina and the choroid of your eyes. Many users report supplementing with saffron has helped them to stop eating junk food, to avoid nighttime snacking, and they're no longer obsessed with thinking about food all the time. Saffron has been proven to help with age-related macular degeneration. Your vision may be sharper, and you can see a line or two further down the Snellen chart at your next eye appointment. Glare from headlights during nighttime driving and flicker from monitors is no longer a problem. You can experience an improvement in mood when supplementing with saffron, no longer overreacting to work-related stress, and it now feels like you're in control again. Many users report an increase in energy and better libido with saffron. Feeling tired and emotional becomes a thing of the past. Clinical research into the efficacy of saffron is encouraging, but trial lengths have typically been limited to 4 to 6 weeks, and sample sizes are relatively small, being 30 to 40 people. Keep in mind the potential for bias because most clinical trials with humans have been conducted in Iran, and Iran produces nearly 90% of saffron for the world market, but these are still high-quality studies. A double-blind, randomized trial with 40 adult outpatients who were suffering from major depression was conducted at the University of Tehran. The study compared saffron petals with Prozac for the treatment of depression. Patients were given 15 milligrams of saffron petals in the morning and the evening, or 10 milligrams of Prozac in the morning and the evening for 8 weeks. The study concluded the saffron petal was as effective as the Prozac in the treatment of mild to moderate depression. The remission rate was 25% in both groups, with no significant differences in the side effects. There's increasing evidence to suggest that saffron could be used in the management of Alzheimer's disease. In one Iranian study, 54 adults aged 55 years and older with Alzheimer's participated in a 22-week double-blind trial. The patients were randomly assigned 30 milligrams per day of saffron, which was 15 milligrams twice per day, or 10 milligrams per day of the drug Aricept. The study found the saffron was as effective as the Aricept in the treatment of mild to moderate Alzheimer's after 22 weeks. Other research showed that saffron can inhibit the aggregation of amyloid beta plaque in the human brain and can therefore be useful in Alzheimer's disease. 46 patients with Alzheimer's volunteered for a 16-week double-blind trial. The patients were randomly assigned 15 milligrams of saffron twice per day or placebo for the 16-week study. After 16 weeks, saffron produced a significantly better outcome on cognitive function than the placebo. The study concluded this double-blind, placebo-conducted trial suggests, at least in the short term, that saffron is both safe and effective in mild to moderate Alzheimer's. 60 adult patients with anxiety and depression were given 50 milligrams of saffron capsule or placebo twice a day for 12 weeks. Depression and anxiety questionnaire was used at the beginning, 6 and 12 weeks during the trial. The patients who'd used the saffron supplement had a significant reduction in anxiety and depression symptoms. The study concluded that saffron appears to have a significant impact in the treatment of anxiety and depression disorder, and side effects were rare. Recommended dose of saffron is 25 to 30 milligrams twice per day for mild to moderate depression. Clinical studies have evaluated doses ranging from 20 to 400 milligrams per day of saffron. Doses up to 1.5 grams per day of saffron are thought to be safe, with toxic effects reported for 5-gram doses. As with many nootropics, more is not better when using saffron. Some research shows that doses above 1.5 grams of saffron can be extremely toxic. Genuine saffron is non-toxic and well tolerated by most people when used at the recommended dose. Some reported side effects of saffron can include headaches, nausea, dizziness, vomiting, and mania, especially if you're bipolar. Saffron can aggravate asthma symptoms. 5 grams of saffron is associated with toxic effects, and very high doses, 10 to 20 grams, can be fatal. No drug interactions have been reported, but interactions with anti-aggregating drugs are theoretically possible. Don't use saffron if you have a bleeding disorder. Saffron is especially helpful for people who are suffering from anxiety and depression. Studies show saffron to be as effective as some popular antidepressants like Prozac, but without the side effects. If you're currently using antidepressants, saffron may help to alleviate the sexual dysfunction that's caused by these drugs. Saffron seems to be effective for appetite control. No snacking between meals, and you're no longer obsessed with food. Saffron has the added benefit of more energy and stamina to help you through the day. You can safely take up to 200 milligrams of saffron daily if needed, but dosed 100 milligrams at a time. Be familiar with the associated side effects of higher doses of saffron. For nootropic use, choose a patented form of saffron supplement. Saffron is also a very effective vision supplement. Driving at night becomes easier. and the flicker that's caused by screens and monitors won't leave your eyes feeling tired all day. For more information about herbs, supplements, and natural treatment plans, check out my website.